with our work that we do, with our responsibilities that we carry out as a daughter, as a mother, as a wife, as a teacher, as a student, daughter-in-law, so many various responsibilities, and the balance of that with our own career, which defines us, and that we are doing each and every day. So that is a celebration in itself when we are achieving that balance day in and day out, because daily there will be some or the other hurdles that will be coming our way, isn't it? Some days there will be some difficulties at home. Maybe a child is not well, so you have to sacrifice something. Or the other day, your in-laws might be needing something. But what I have found in the successful women's in our field and in other fields as well, the one who is able to carry out this Herculean task and able to give equal balance between both of these things, may it be the house, children, or their own career. They are the women who have been successful in their life, and we keep them as our role model. And if we study their life history, it is not an easy task for sure, but they have carried it out with a grace, and that's why they are celebrated. So I think on this occasion of International Women's Day, I would rather welcome all our women folks of Swara Homeo Gurukul to carry out the responsibilities of their own self in the house as well as in the clinic. Because if we are missing any of the responsibilities, then it becomes, the life is incomplete. We should be all-rounder in each and everything that we do. That's what Shekhar sir always tell us, whether it is cooking or household work or taking a case or giving a lecture. Everywhere you should put your 100%, balancing everything wherever you are needed at that moment of time, not getting entangled with the emotions, but understanding what is the need of the hour. Where am I required more? What is my responsibility? And I think that gives us the self-confidence and self-worth to stand erect and answer to whatever questions that are coming to us. I think that is the best gift that a guru can give to all of us. So let us start for the today's topic. And today, on the occasion of International Women's Day, we will be dealing with how homeopathy can help for the female disorders. And today we have three presenters. Dr. Vishva, who is a young, enthusiastic homeopath from Ahmedabad.
Good afternoon, everyone. Today's session 52, Swara Online Discussion Portal, and today's topic is female disorder. First off, I like to wish you all the female very happy Women's Day, and I like to read something for a woman. I want to be remembered as a woman who dared to be a catalyst of the change. It's once said by Shirley, and the other one is woman. A man is born from woman. Man is born from a woman. Man is educated by a woman. He grows with a woman. He fall in love with a woman. He married to a woman. So why lack respect for them when you are the hope of this life and the balance of the world? So much respect to all the women. And today's my presentation, a case of 42 years old female with the white discharge from vagina. A verbatim of the patient. I said, yes, please tell me in detail. Patient says, at first, I only had an infection. It just itched a lot. So I applied powder, ointments. Every summer, I have a rashes in my thigh. So I thought it would go away on its own. But this time, it was very itchy. So I saw the gynecologist and they give me some medicines and ointments. It was fine for 2 days and it happened again. Here, the patient thought कि again and again every summer that is rashes, so it goes by own, but it doesn't go. So she went to the gynecologist. Then she says, last night it was a very itchy, so the redness came. Otherwise, it was not there. And white discharge has also been coming a lot since a month or week. I think this white discharge is causing the itchiness. पेशेंट को लगता है कि व्हाइट की डिस्चार्ज की वजह से उसको इचिंग हो रहा है. तो आई सेड देन शी सेड I never eat fried, hot, spicy, but it happens. I don't know why. The white discharge comes on its own and stops on its own. But this time, it doesn't stop. And my menses has also stopped for 2 years. उसकी menses भी 2 साल से चली गई है और वो थॉट कर रही है कि क्यों हो रहा है. मैं स्पाइसी भी नहीं खाती हूँ, फ्राइड नहीं खाती हूँ, फिर भी हो रहा है. Then she said, my neighbor told me about you today morning, so I came to here. And it is better to show it to the gynecologist first. So I showed it to gynecologist at first, and I told him to get my sonography done. So that we can know what is happening inside. Because now new skin diseases are happening and we don't even know about them. उसको लगता है कि अभी बहुत सारे नए स्किन डिसीज हो रहे हैं तो सोनोग्राफी करवाना जरूरी है. सो उसने गायनेकोलॉजिस्ट को सोनोग्राफी करवाने को बोला. देन आई सेड न्यू डिसीज मींस. शी suddenly started laughing and said nothing and avoiding. After some time she said, if some other disease had occurred, I don't know what would happen. Then she said, there are many thoughts in my mind regarding this. I said, like? Then she again started laughing. Many thoughts, ma'am. What will be inside? Now I have done my sonography, so I know it's an infection. But because the outside is healed, itching inside is still going on. So you can find out only in the sonography. तो यहाँ पे वो मुझे ऐसे बता रही थी जैसे सोनोग्राफी करवाना जरूरी है. Then she said, I had all the sonograms done because I thought there was something inside. Because when my husband and I got together, I had a lot of pain inside. Pain during position. Please give me some medicine fast. Due to white discharges, there is a itching and burning, even during urination also. So I said, where is your reports? She said, I didn't bring it. Nature-wise, she is a very talkative, laughing a lot during case taking, asking again and again and for a reasons and reports. So this is a case. So I said, let's examine. On examination, I found lots of milky white discharge in vagina, lots of redness in thighs, vagina, and vulva. At the examination table, she said suddenly, ma'am, I even can't wear underwear since long due to this complaint. I even can't bear the touch of undergarments. So I said, okay, let me give you medicine. So this is the case. The analysis of the case, she has a lots of milky white discharge, itching, redness, burning in vagina. So she took it lightly at first. Then when things didn't go well and thoughts turn on in mind, she want to know what's going on inside. If some other disease is there, then what will happen? She avoids some answers by laughing, hiding as sometime want to know about the disease. So follow-up of the video case in verbatim. I translate it. She said, no any white discharges, no itching. Due to white discharge, I had lot of leg pain, which is completely cured. I said, out of 100, how much you feel relieved? She said, out of 100, almost 90% cured. Even now, question also not that much painful. So, from synthesis, repertory analysis, I took the rubric light desire for mind, quick to act, morning in the morning, in neighbor says about me, and evening she came, so I rubric quick to act. Fear darker, objective reasonable, mind hiding himself. It's visible also in the clinic. Mind laughing, speaking when. And then I took physical rubric, female genital, question painful, female genital, discoloration red, female genital, itching, female genital, leucorrhea milky, and leucorrhea copious. So medicine comes belladonna. From complete repertory, I also took two general rubrics. Generality, redness, bright red mucous membrane. In generality is swelling red shiny. So medicine comes belladonna. In materia medica, I found everywhere leucorrhea milky in belladonna, but I didn't get it. So once Dr. Priyanka ma'am told me, whenever you found medicine similar to patients, but you didn't get from materia medica, search for everywhere and anywhere, you find it. So I found in encyclopedia, leucorrhea under belladonna, leucorrhea and colic, fleshy colored or milky leucorrhea. And this is an acute and short-acting remedy. Sudden and violent onset is a keynote of this remedy. Pains come suddenly and disappear suddenly. Inflammatory condition of the body or a particular organ with violent pain and intense heat mark this remedy. The affected part are red and sore, and throbbing of the affected part is another characteristic. And in the Kulkarni Materia Medica, I found the throbbing about the parts and senses of weight. The stitches in vagina with sensation of great heat and dryness. The female parts are sensitive, can't bear neither touch nor least jar. The parts have a scarlet red appearance and inflammation of the external genitals. So the level of experience of the patient, name or fact level. So I give her Belladonna 30 TDS for 2 days. Next follow-up. First time she come to me 23rd June 2022, and I said her to come 24th because there is a lots of redness and itchiness. So 24th, she said almost 40 to 50% better. Redness goes down and relax feeling. After that, she comes after 7 days. She said lots of leucorrhea decrease, but position is still painful. So I give her Belladonna 1 m, give her SL for 10 days. She again come after 3 months, 26 October 2022, and she said position is still painful, but in between sometimes it is a better. So I give her Belladonna 30 that time. And again after 3 months, she 19 December, she came and said, sometimes it's painful. So I give her Belladonna 200. And again after 3 months, 27 February 23, she came and said, this time it is almost better, but I come to inform you that I'm fine. So this is the case. Learning from this case is sometimes we avoid such physical examination, which one equally important in for remedy selection in the cases where patient doesn't go deeper in emotional or delusion level. That time physical examination is equally. Thank you everyone. Thank you Swara team. Thank you Priyanka ma'am for giving me such opportunity to present my experience here. Thank you.
Very well done, Vishwa. Excellent, I must say. And we all are very happy and delighted with your progress that you are doing. I'm really very happy. So very good case you have presented. Just one suggestion after your presentation that I would like to give is, whenever you are selecting a remedy and that is acting well in the patient, then if you have to increase the power of that remedy, then it should always go one step ahead. By that, what we give is, we give full potential of the remedy and a chance of that particular potency to act on our patient's body. In your case, after 30, you have directly given 1 m, okay? And after that, 200. If you analyze your case once again, if you read it, the 200 power has suited her the most. And after that, her complaints have been subsided. So after 30, if you would have given 200, then there wouldn't have been any need to give 1 m. Might be. And if need be, then after 200, we can give 1 m. So by that, we are slowly and steadily and stepwise increasing the power of the remedy and giving it a full validation, full time for the dedicated potency to act on person's body. So by going like this, we are following the principles also of homeopathy, and we are helping the patient in the right direction. And it's a good learning lesson for us also, how much percentage 30 potency have helped the patient, then 200 have helped the patient, and then later on 1 m has helped the patient.
Yes, ma'am. I also want to share from this case. I also noticed that I mistakes in selection of potency. That's why I'm presenting it. Because after 30, I direct jump to 1 m.
Correct.
And that's why she come again and again. And when I give her 200, then after she stopped. So it's also great learning for me.
Very good, very good. And you are really doing excellently well and putting your heart and soul into your patients. And you will definitely do very good in future. We are sure about that.